Thank you for reviewing this pre-op education prior to your knee replacement surgery. I'm Claudia O'Connor, the care coordinator of the Joint Replacement Program at Essentia Health St. Mary's Medical Center. I'll be in contact with you before, during, and after your hospital stay. The mission of Essentia Health is to partner with you to provide an excellent patient experience, supported by the mission of the Joint Replacement Program, which is to produce a well-educated patient who's prepared for joint replacement surgery and recovery. People who are educated about their surgery and planned recovery are less anxious, better able to manage their pain, and may have a shorter hospital stay. The objectives of this education session are to discuss your knee replacement surgery, getting ready, preparing both yourself and your home, discharge planning, what is the best and safest discharge plan for you, what to expect during your hospital stay, the day of surgery, your pain management, your daily routine in the hospital, what to expect after your hospital stay, caring for yourself at home, and knowing when to contact your surgeon, physical therapy before, during, and after your hospital stay. This class is a supplement to the surgical guidebook that you received during your surgical consult visit with your orthopedic surgeon and his nurse. Please use this book throughout your surgical journey. Bring it with you to your pre-op appointments, to the hospital, to the rehab facility if that is where you will discharge to, and to any post-op appointments including physical therapy. Please refer to the guidebook during this session. Jot down notes or questions for follow-up or clarification. The knee is the largest joint in the body, and having healthy knees is required to perform most everyday activities. The knee is made up of the lower end of the thigh bone or femur, the upper end of the shin bone or tibia, and the kneecap or patella. In a healthy joint, the ends of these three bones are covered with cartilage, a smooth substance that protects the bones and enables them to move easily. Arthritis, or simply years of use, may cause the cushioning cartilage to soften and wear away. The bones then rub against one another, causing knee pain and stiffness. Knee arthritis can affect one side of the joint more than the other. This X-ray image shows how the cushioning cartilage has worn away, allowing bone to touch bone. This X-ray image shows the knee with the implant or prosthesis in place. Your surgeon will determine what is the best type and size of implant for your body shape and size. The X-ray also shows the staples in place. The staples are usually removed at your first post-op clinic visit at 10 to 14 days after surgery. Unicompartmental or partial knee replacement is an option for a small percentage of patients with osteoarthritis of the knee. To be a candidate for this type of procedure, your arthritis must be limited to one compartment of the knee. In a uni-knee replacement, only the damaged section is replaced. The healthy cartilage and bone in the rest of the knee is left alone. Patellofemoral arthritis occurs when the cartilage on the underside of the patella or kneecap wears down. When the cartilage wears away, it becomes frayed, and when the wear is severe, the underlying bone may be exposed. Moving the bones along this rough surface is painful. During this partial knee replacement, worn down bone and cartilage surfaces are removed and replaced with metal and plastic implants. Patellofemoral or PFJ replacement surgery would not be done if arthritis also involves other areas of the knee. We want you to be in your best physical shape for your surgery. The physical preparations you can make affect both the outcome of the surgery and your recovery time. A pre-op physical is done at your primary care clinic within 30 days of surgery. You'll need to have this checkup to determine if you're healthy enough for the actual surgery. It will generally include a physical examination and might include heart tests, x-rays, blood, and urine testing. During this exam, you should inform the provider about any medical and surgical problems, as well as provide a list of medications you are currently taking. It's very important that you get to this appointment. If you have a conflict and you're not able to attend as scheduled, contact your orthopedic surgeon's nurse. If you have diabetes, your blood glucose needs to be in good control. During your pre-op physical, your provider should review your blood glucose levels and develop a plan for improvement if needed. Your provider should also review your diabetes medications. You may need to stop some of the diabetes pills before surgery. You should also have a plan for your insulin dosing the night before and morning of surgery. Everyone should schedule or should have had a recent dental checkup and cleaning. Dental conditions and problems should be treated prior to surgery. A dental infection would delay or cancel your surgical appointment. Your surgeon would prefer that you don't have routine dental cleanings or appointments for at least 6 weeks following your joint replacement. If you smoke, cut down or quit. Smoking changes blood flow patterns, delays healing, and slows recovery. If you need a nicotine replacement, such as a nicotine patch, discuss that during your pre-op appointment. Other resources to help you stop smoking are listed in the Helpful Resource section of your guidebook. You may take your regular prescription medications up to the day of surgery. Your surgeon's nurse will provide you with a list of medications to stop prior to surgery if needed. This might include aspirin, non-steroidal anti-inflammatories or NSAIDs, and some vitamins and herbal medications. If you are taking an anticoagulant such as Coumadin or warfarin, your surgeon's nurse or the clinic that manages your anticoagulation dosing will tell you when to stop that medication. The condition of your skin is extremely important to help prevent infection. This is especially true for the skin over your legs and around the planned incision area. Open sores, areas of infection, irritation, or swelling can increase the risk of problems like surgical site infection and poor wound healing. You must let your orthopedic surgeon know if any skin changes occur between your last office visit and the day of surgery. Do not shave your leg or the surgical area for at least 7 days before surgery. It's important to maintain a healthy, well-balanced diet. Good nutrition before and after surgery is important. Because constipation is common following surgery, you're advised to add extra fiber, such as bran, to your diet. Start the pre-op exercises in your guidebook. Start them now or at least 2 weeks before surgery. You should try to exercise 1 to 2 times a day, every day. It's important to be as fit and strong as possible before undergoing a joint replacement. Strengthening the muscles around your knee and in your legs and arms will help make your recovery progress faster. The exercises can be done on a bed, a sofa, or recliner. No fancy equipment is required. All you need is a firm surface and a rolled towel. Perform the exercises as pain allows. It will make you more familiar with the exercises and your muscles will be stronger. It will also be easier to do the exercises post-operatively. Your pre-op exercises are the same as the exercises you'll do in the hospital and once you're discharged doing your home exercise therapy program. Recovering from joint replacement surgery takes time. You can take steps now that will help your recovery be easier and faster. Planning ahead is key to minimizing stress and optimizing your outcome. Some suggestions include: clean your house and do your laundry. If you do the cooking, make double batches of everything for a week or 2 before surgery. Freeze half of those meals and you'll have 2 weeks of made-ahead food, or you may prefer to stock up on ready-made meals that you enjoy. While you're in the kitchen and also other rooms in your house, place items you use regularly at arm level so you don't have to reach up or bend down. Borrow a walker or a pair of crutches and see how well you can maneuver through your home. You may need to rearrange furniture or temporarily change rooms. For example, make the living room your bedroom. Remove any throw or area rugs that could cause you to slip. Securely fasten electrical cords around the perimeter of the room. Set up a recovery center where you can spend most of your time. Things like the phone, a remote control, a radio, facial tissues, a wastebasket, water pitcher and a glass, reading materials, and medications should all be within reach. Consider modifying your bathroom to include a shower chair, grab bars, and a raised toilet. Shop for things that will make your life easier after surgery. Your list might include a long-handled shoehorn, a long-handled sponge, a grabbing tool or reacher, a footstool, a big pocket shirt, or a soft shoulder bag for carrying things around. Our goal is for most patients to go directly home from the hospital after joint replacement surgery. It's important for you to consider the kind of help you will need and to mobilize your friends and family to assist you with shopping, cleaning, errands, transportation, etc. Find family members or friends who are willing and able to assist you for at least the first week that you are home. Arrange for family or friends to drive you home from the hospital. You may be most comfortable in a sedan-type car. Insurance will rarely cover help at home for bathing, dressing, cooking, or cleaning. It's best to plan ahead and get assistance from family and friends, church groups, or social clubs. There are home care agencies that provide home health aides for this type of help, but it would usually be an out-of-pocket or private pay expense. Home care services might be available for home physical therapy and nursing care 2 to 3 times a week. These services depend on your medical needs, your insurance coverage, and the availability of the services near your home. These services would be arranged during your hospital stay if they are appropriate. Some patients need more help and services than what can be provided at home. These services can include skilled nursing care, additional rehab therapy, or both. If you think you might need inpatient rehabilitation after hospital discharge, you must understand that there are certain criteria for admission to those facilities that must be met in order for insurance to cover the rehab stay. To prepare for a short-term rehab facility or swing bed stay, there are a few things you can do ahead of time. Choose at least 2 facilities where you would be comfortable and that provide the rehab services you require after joint replacement. If possible, visit each of these facilities before surgery to discuss the services that are provided. It is possible that your first choice of facility may not be available due to insurance restrictions or bed availability, and you will need to receive rehabilitation at your second choice. Final discharge plans are made after you are admitted to the hospital. If you're going to a short-term rehab facility, you will need transportation to the facility. Some Duluth and Superior area facilities will pick you up at St. Mary's Hospital. Other options for transportation are a family member or a friend, or possibly hiring a transportation company. A medical transportation company would use a wheelchair or stretcher to take you to the facility. This expense is rarely covered by insurance providers. It requires cash, credit card, or personal check on the day of the service. The day before or the Friday before your surgery, if surgery is on a Monday, a nurse from the pre-procedure department of Essentia will call to tell you what time to arrive at the hospital the day of surgery. Please be ready to tell that nurse your medical, surgical, and anesthesia history, your current medical conditions, the name and dose of the medicines you take. The nurse will tell you where to park and register the day of surgery, when to stop eating and drinking, and which medications to take the morning of your surgery. Please bathe or shower the evening before and the morning of surgery with the Hibiclens soap given to you by your surgeon's nurse. If you've misplaced the soap packets, contact the orthopedic department to obtain more. Do not use the Hibiclens on your face, hair, or genitals. Use one packet for each of the showers. Then don't use any lotions, creams, powders, or ointments on your skin after using the Hibiclens. Dry off with a clean towel after showering or bathing. Wear clean pajamas to bed and sleep on clean sheets. Then wear clean clothing to the hospital. On the day of surgery, you'll be admitted to the hospital on the 3 North Outpatient Nursing Unit. You'll meet your surgeon there to have last-minute questions answered, and your correct surgical leg will be marked and verified. You will meet with the anesthesia team prior to going into the operating room. An anesthesiologist will discuss the safest type of anesthesia for you based on your medical history and the type of surgery you are having. If you're having a nerve catheter or nerve block placed for post-op pain control, this will be done before you go into the operating room. While you're in the operating room, your family can wait in the 4th floor surgical waiting room. A volunteer will be available for questions and to help your family stay informed on your progress through surgery and the recovery room. Your surgeon will speak with your family following the surgery. Most people are in the recovery room or PACU for 1 to 2 hours. From there, you'll be assigned a bed on the orthopedic unit. This will also be on the 4th floor of St. Mary's Medical Center. Expect that you will have pain after your surgery, but with your help, we'll try to make your recovery as comfortable as possible. Tell us about your pain. The staff will ask you to rate your pain on a scale from 0 to 10. 0 means that you have no pain, and 10 means that you have the worst pain you can imagine. Rating your pain helps your healthcare team measure how much your pain medicine is helping you. Your surgeon or anesthesiologist will decide what pain treatment would help you the most after surgery. The nursing staff will establish a mutual pain goal each shift so that your pain or discomfort is managed so you can eat, sleep, and move around. There are many techniques used for pain control. A regional block gives pain relief by blocking a nerve or a group of nerves. It may be a single injection, or local anesthetic may be given continuously through a small tube or catheter. Opioids are a strong pain medicine most often used for severe pain for a short time after surgery. They can be given either IV or orally. Examples are Dilaudid or oxycodone. Side effects of opioids can be drowsiness, nausea, constipation, and itching. NSAIDs, or non-steroidal anti-inflammatory drugs, reduce swelling and soreness. They relieve mild to moderate pain. They are sometimes used along with opioids. Examples are ibuprofen, naproxen, and Toradol. These drugs may reduce the need for stronger pain medications. Your nurse will also discuss and encourage you to elevate your surgical leg and keep an ice pack on your incision area to reduce post-op swelling. You will be repositioned frequently to help you find a comfortable way to lay or sit. Guided meditation can also help you relax and be less painful after your surgery. If you received a Playaway guided imagery device from your surgeon's nurse, please begin using it as soon as possible. Bring it with you to the hospital. You will use it before, during, and after your surgery. If you did not receive a Playaway device and would like one, please contact the orthopedic clinic. Part of the pre-op preparation the day of your surgery will be meeting with an anesthesiologist who will be placing a femoral nerve catheter or a regional nerve block. A femoral nerve catheter numbs the front of the knee to give you pain relief after surgery. You may still have some pain in the back of the knee. By numbing this part of the knee, you will have less pain after surgery and need less medication with fewer side effects. The anesthesiologist will perform an ultrasound of the upper thigh area to see the femoral nerve, which supplies nerve impulses to the front of the knee. A small catheter or tube will be then taped securely to your thigh. This catheter will deliver a continuous infusion of a local anesthetic. Part of your leg will be temporarily numb and weak. The catheter generally stays in place until the early morning of post-op day number 2. The numbness will then gradually wear off over the course of the day. You will wear a knee immobilizer or a splint as shown in these photos when getting out of bed, the chair, or walking until a physical therapist has determined that your thigh muscle has strength and that the sensation has returned to normal. After surgery, you may feel lightheaded from anesthesia or pain medication, and your muscles might be weakened or numb from surgery or anesthesia. It's very important that you never get out of bed, out of the recliner chair, or do any walking without the assistance of therapy staff. An alarm will be placed on your bed and on your chair to remind you to call. Please call, don't fall. Our goals for you the night of surgery are that your pain is well controlled, you're able to eat and drink a regular diet, and that the nurses will assist you into a recliner chair. The nursing staff will check on you often, at least every hour, to monitor your pain level, your vital signs, and to administer your medications. Your home medications will be restarted and you will begin your anticoagulation medication such as Coumadin or aspirin to help prevent blood clots. Please tell your nurse if you have any noise sensitivities. We have sleep masks and earplugs available if needed. The first morning after surgery, post-op day 1, begins early. You'll have blood drawn between 5:30 and 6:30 a.m., and then the nursing staff will be in to help you clean up and get dressed in the comfortable clothing you brought from home. Loose pants or shorts are usually the best choice for that clothing. The staff will assist you into a recliner chair for breakfast so that you're ready for the day. We want you to feel well while you're here, and getting dressed and out of bed will help. You'll be seen by a physical therapist in the morning for a therapy evaluation. The therapist will have you begin working on your post-op exercises, the same exercises as in your guidebook. That afternoon, you'll have your first group therapy session in the physical therapy gym. The exercise sessions usually last about 45 minutes. If you've had a partial knee replacement, you might be ready for discharge late afternoon on post-op day 1. You will be assisted to a recliner or therapy chair the evening of surgery. We encourage you to spend much of the day in your recliner chair with your feet elevated to help reduce swelling. You'll also be transported to and sit in this chair during your physical therapy sessions. The evening of surgery, you'll begin to walk short distances in your hospital room and in the hallways. This early activity improves your recovery and helps your knee regain its strength and movement. The hospital hallways are measured in 25-foot sections. An ambulation board in the hallway allows you to track your walking progress during your hospital stay. A good rule of thumb is to walk at least 150 feet before discharge. As an important part of the joint replacement process, the rehab or recovery coaches with the patient from the pre-op stage through the hospital stay and into the hospital discharge and recovery at home. You are encouraged to select a family or friend who is able to assist you with this surgical journey. The coach will attend therapy sessions to help you complete exercises and to provide encouragement and support. The hospital staff encourages the participation of the coaches to educate, to encourage, and to facilitate a smooth transition to home for both the patient and the coach. For patients who don't have a coach available during a hospital stay, a limited number of volunteers have been trained as hospital patient coaches during physical therapy sessions. On the morning of post-op day 2, the nursing staff will again assist you with your morning bathing and dressing in your clothes from home. You'll be encouraged to spend much of the day in your recliner chair. If you have a nerve catheter for pain control, it will be removed early this morning. You will be scheduled to attend a discharge information class in the morning. Following class, you'll have group physical therapy. This therapy session is followed by a soup and sandwich group luncheon for you and your coach, along with other patients, staff, and volunteers. A second therapy session will be held this afternoon. Some people may be ready to discharge home following the afternoon therapy session. Group physical therapy and the group soup and sandwich luncheon provide you and your coach with an opportunity to learn from the questions and experiences of other families and patients going through the joint replacement process. Post-op day 3 begins like days 1 and 2 with the nursing staff helping you bathe, dress, and get out of bed into the chair before breakfast. You'll have one more group physical therapy session this morning. Invite your coach to attend this final therapy session. You'll be ready for discharge following therapy and before lunch. Please arrange to have your ride pick you up then. Your surgeon discussed possible surgical complications with you during your consult visit. During your hospital stay, we'll do many things to prevent those complications. To prevent pneumonia or a fluid buildup in your lungs, you will do breathing exercises using deep breathing and coughing. Your nurse will instruct you on using an incentive spirometer to open up the air sacs in your lungs. Getting out of bed the night of surgery and being active during your hospital stay will also help to prevent lung congestion or pneumonia. After any major surgery, particularly orthopedic surgery, you're at a risk for getting blood clots in your lungs. If a piece of a blood clot breaks free from your leg and travels to any other part of your body, serious complications such as a stroke, heart attack, pulmonary embolism, or even death can occur. We'll do many things to prevent a blood clot from forming. You'll wear anti-embolism or TED compression stockings. These are put on before surgery and are to be worn for 4 to 5 weeks after. The ankle pump exercises that you begin before surgery will continue after to keep the blood flowing back up to your heart. Foot pumps will be placed on your feet in the hospital. They periodically inflate, squeezing your feet to help return blood from your legs back to your heart. This will help prevent blood from pooling in your legs and forming clots. Increasing your activity in the hospital and at home will also help prevent clot formation. You will be started on an anticoagulation or blood thinning medication the night of surgery. Your surgeon will determine which medication is best for you based on your past medical history. Medications commonly used are aspirin, Coumadin or warfarin, and Lovenox. Most likely your surgeon discussed this with you during your surgical consult visit. Preventing a surgical site infection is very important following a joint replacement. Your incision will be covered with a strip of gauze and a waterproof dressing. This dressing should not be removed or changed after you leave the hospital unless it becomes saturated with drainage or blood. If you do need to remove the dressing, wash your hands, do not touch the incision, then keep the incision cleanly covered and contact your surgeon's office for instructions. Constipation is common following surgery. Increasing the fiber and fluids in your diet will help to prevent it. You'll be started on a stool softener the night of surgery. This medication will also be prescribed to be used at home. Increasing your activity will also help to prevent constipation and gas. When you go home, there are many things you need to know for your safety, recovery, and comfort. To reduce pain and swelling, take adequate pain medications to allow you to sleep well at night and to do your home exercise program 2 times a day. Prolonged pain and insufficient rest will slow down your recovery process. Elevate your leg to reduce swelling. To elevate your leg correctly, your knee and ankle must be above the level of your heart. Get your toes above your nose. The best position is to lie down on your back with 4 or 5 pillows lengthwise under your entire leg. Elevating your leg on a stool or recliner is not adequate to reduce swelling. Elevate the leg 3 to 4 times each day for at least 20 to 30 minutes at a time. Ice should be used to relieve pain and to also decrease swelling. Keep it in place for 15 to 20 minutes. Use ice when elevating your leg and throughout the day if swelling does occur. Sleep with a pillow between your legs for the first few weeks. If you normally sleep on your side, keep the surgical leg on top until your incision is healed and you're comfortable. You may have bruising on your surgical leg, which could extend from your thigh down to your toes. This is normal and will gradually fade away. Your incision is closed with staples, which will be removed at your first post-op visit. This area may be bruised for a while, may itch, pull, or feel numb. You may experience a burning sensation, which can be relieved by using an ice pack for 10 to 15 minutes. Some loss of appetite following surgery is normal. Continue the increased fiber and fluids in your diet to prevent constipation. If dietary changes and the prescribed stool softeners aren't effective, you can buy over-the-counter products such as Colace or Miralax. To prevent blood clots at home, wear your compression stockings during the day for at least 4 weeks. The stockings can come off at night and when showering. Get up and move at least once an hour during the day. Continue doing your ankle pumps. Take your anticoagulation medications as directed. If you have any questions about the medication, contact your surgeon's office. Continue your twice daily physical therapy exercise program. You will gradually resume your normal activities. The physical therapy staff will give you more activity guidelines during your hospital stay. You will not begin driving until you have stopped taking any opioid pain medications, you're able to get into and out of the car easily, and you have good control of your surgical leg while moving it from the accelerator to the brake. This may take 3 to 6 weeks. Discuss driving during your first post-op visit. Once you are feeling ready to begin driving, have your coach bring you to a parking lot to practice. If your coach feels safe, you might be ready. A common cause of infection following joint replacement surgery is from bacteria that enter the bloodstream during dental procedures, urinary tract infections, or skin infections. These bacteria can lodge around your joint replacement and cause an infection. After your joint replacement, you must take preventative antibiotics before any dental procedures, including routine checkups and cleanings. These antibiotics must be taken for the first 2 years following the joint replacement. Certain medical conditions may require you to take the antibiotics for the rest of your lifetime. This is determined by your surgeon and should be discussed with him. Let your dentist know that you've had a joint replacement. The antibiotic can then be ordered by your own dentist or by your orthopedic surgeon. The medication dose is taken 1 hour before your dental appointment. Any infection in your body can spread to your joint. If you have had symptoms of an infection such as a bladder or skin infection, report this to your primary care provider for evaluation and possible treatment. Before your discharge from the hospital, your nurse will review your discharge instructions and after-visit summary with you. This summary is specifically written for you by your surgeon. It will include information about your follow-up appointments, your medications, incision care, activity restrictions, and when to contact your surgeon. Keep the discharge materials handy when you get home and refer to it if you have questions. If you can't find the answer to your questions or concerns in the documents, please contact the orthopedic clinic and speak with one of the nurses. The success of your surgery will depend largely on how well you follow your orthopedic surgeon's instructions during the first few weeks after surgery. Contact your surgeon if you notice any opening in your incision. Your incision will be held together with staples, which normally should not come apart. They are removed at the first post-op visit. If the skin around your incision should look reddened, or if it becomes extremely tender, or if you have drainage or fluid from the incision that is yellow, green, or looks like pus, or has a foul odor, please call your surgeon. If your incision begins to bleed and soaks the dressing, or if the bleeding isn't contained by your dressing, let the surgeon know. If you're taking pain pills as they're prescribed, you're elevating and using ice to relieve swelling and your pain is not controlled, you'll want to contact your surgeon. They may possibly make an adjustment to or change your pain pills. If the elevation and the icing is not relieving the swelling, contact the office as your leg may need to be examined. If you have a sudden increase in pain in your surgical leg, which doesn't respond to your pain medications as they are prescribed, or if your foot or leg becomes numb or tingly, notify your surgeon. If you're not able to tolerate your pain medication because of nausea or vomiting, the medication may need to be adjusted, or another medication for nausea may need to also be prescribed. It's not uncommon to have a low-grade fever the first few days after surgery due to anesthesia or even some pain medications. However, if you develop a fever greater than 100 degrees and it lasts for more than 24 hours, contact your surgeon. If you have chills with the fever, you should also update the surgeon. If you don't think you're making good progress with your home exercise program, contact the surgeon's office. A fall during the first few weeks after surgery can damage your new joint and may result in a need for further surgery. Stairs are a particular hazard until your joint is strong and mobile. Be careful, and if you should fall, let your surgeon know. If you have any symptoms of sudden chest pain or sudden shortness of breath, this is a medical emergency. Call 911 and go directly to an emergency room. Your therapy sessions will begin the morning of post-op day 1. You will initially have an individual get-to-know-you session with a physical therapist. The physical therapy staff will instruct and guide you on your home exercise program. Post-operatively, we'll work on exercises in a group setting. This will provide an opportunity for the patient and coach to work together on the exercises under the supervision of therapy staff. The goal is to be independent with these exercises. The physical therapy staff will also work with you to achieve ambulation goals. Your ambulation goal for your hospital stay is to increase your walking distance each day, to move safely and independently with a walking device, and to go up and down stairs if needed at home. All patients will initially walk with a walker. If you prefer to use crutches, the therapy staff will assist you in using them. All patients will use a two-wheeled walker or crutches full-time for the first 2 weeks following surgery. At your first post-op visit, your surgeon will let you know if you're ready to progress to a cane. Family or friends likely have equipment that you can borrow. Community organizations such as VFWs, Lions Clubs, and churches may also have loan closets. A prescription is needed to have a walker purchase or rental covered by insurance. This prescription will be given during your hospital stay, but not before. If you're unable to obtain your equipment preoperatively, we'll assist you with obtaining it while you're in the hospital before you go home. If you're going to a short-term rehab facility, that facility will assist you in getting a walker or crutches when you're ready to discharge from that facility. Post-operatively, patients may struggle to stand from a standard height toilet. Increased toilet height and grab bars to push or pull from can make the task easier and safer. This equipment is often not covered by insurance. Therefore, no prescription is required, and you can get the equipment preoperatively if you wish. Toilet risers are available with a variety of features. A standard toilet riser costs about $23. A standard toilet riser with a locking clamp is about $40. And a toilet riser with a locking clamp and handles is about $46. Over-the-toilet commodes can be rented or purchased, and insurance might cover the cost. Rental is about $26 per month. A purchase price is about $100. Many of these items can be borrowed or can be purchased at medical supply stores or other retail locations. You can shower post-operatively while the incision is healing, as long as the incision is covered with a waterproof dressing. A seat for the tub or shower may be necessary and beneficial because stepping over the edge of the tub may be limited due to pain and mobility. With post-op fatigue, you might not have the tolerance to stand for the length of time needed to shower. Insurance generally does not cover a tub seat. Again, no prescription is required, and you can get this equipment preoperatively if you wish. It may be possible to rent some of the equipment from a medical supply store or to purchase from a local retailer. These items are often also available to borrow. A standard tub seat without a back rents for about $17 and may be purchased for about $40. An extended tub seat rents for about $15 and may be purchased for about $100. Also consider installing grab bars and a handheld shower head in your bath. In the early stages of recovery, your activity will primarily consist of daily activities such as bathing, dressing, and light household chores, along with the twice daily post-op exercises. We do not encourage walking as a form of exercise at this stage of recovery. Over time, you'll start to feel better and find that you're able to do more. With the guidance of your surgeon, you'll gradually resume activities such as walking, biking, dancing, golfing, swimming, bowling, and gardening. Activities that you should permanently avoid include running, jumping, and repetitively lifting of more than 50 pounds. These activities can put stress on your new joint, and the restrictions should be discussed with your surgeon at one of your first post-op visits. Every surgery is unique, with a plan of care individualized for you. We want you to be well educated and successful and to have an excellent experience before, during, and after your surgery. Thank you for your attention today. If you have questions or concerns regarding your surgery, please contact your surgeon's office. If you are a MyHealth participant, send an email. Otherwise, call the clinic and ask for your surgeon's nurse. You may also contact me, Claudia O'Connor, RN, Care Coordinator of the Joint Replacement Program.